Chromatography. Chromatography is a powerful analytical and preparative technique used for separation, identification, and purification of components in a mixture. It is especially important in clinical laboratories, pharmaceutical industries, toxicology, and research. Principles of chromatography. The principle of chromatography is based on the differential distribution of the components of a mixture between two phases, namely stationary phase and mobile phase. So, stationary phase is basically a solid or a liquid supported on a solid, for example, silica gel, cellulose, or resin. It remains fixed in a place. Whereas mobile phase is a liquid or a gas that moves over or through the stationary phase and carries the components with it. Components that interact more strongly with the stationary phase will move slower, while those interacting more with the mobile phase will move faster. Thus, separation occurs based on adsorption, partition, that is solubility, ion exchange, molecular size, and affinity. Classification of chromatography. It can be classified on mobile phase. So, if the mobile phase is liquid, it is liquid chromatography. For example, paper, thin layer chromatography, HPLC. And if the mobile phase is gas, then it is called as gas chromatography. So chromatography is also classified on the basis of separation mechanism, which can be adsorption, partition, ion exchange, size exclusion, or affinity. And based on the mechanism, there are different type of techniques. For example, column chromatography, thin layer chromatography, it uses adsorption as a mechanism. Similarly, gel filtration chromatography uses size exclusion principle. And paper chromatography in HPLC uses partition as the principle for the separation. So moving on to various types of chromatography. Firstly is paper chromatography. The principle here is partition. So partition between liquid stationary phase, that is water in cellulose fibers, and mobile phase, that is organic solvent. So procedure is that a sample is applied on paper and solvent moves via capillary action. Component separates as spots. It is used for separation of amino acids, sugars, and drugs in urine. RF value, that is just a retention factor value. So retention factor value is basically distance traveled by the substance divided by distance traveled by the solvent front. Moving on towards the next type, that is thin layer chromatography, that is TLC. So the principle of thin layer chromatography is adsorption. It's an adsorption chromatography. Silica or aluminium is used as a stationary phase in this chromatography. So the mobile phase here is a non-polar or polar solvent, can be either. Advantages of this is that it is faster than paper chromatography, it has a better resolution, and it detects nanogram levels. Clinical uses include drug detection, lipid analysis, and purity check of pharmaceuticals. Next is column chromatography. The principle is adsorption or partition. So the setup involves a glass column packed with the stationary phase, which can be silica or alumina, and the mobile phase is added from the top. It is used for separation of large sample volumes like pigments, alkaloids, and enzymes. This picture is showing different stages of column chromatography. It has variants, for example, normal phase and reverse phase. When the stationary phase is polar in nature, it's called normal, and if the stationary phase is non-polar, then we call it reverse phase. Then we have ion exchange chromatography. The principle here is separation based on charge, ions, right? So the stationary phase here is an ion exchange resin. It can be cationic or anionic. Clinical uses include serum protein separation, HbA1c analysis in diabetes, and amino acid analysis. So it can be categorized as cation exchanger or anion exchanger. Cation exchanger has the resin which is negatively charged, whereas anion exchanger has resin which is positively charged. Next is affinity chromatography. Affinity chromatography is based on the principle of specific binding affinity between the molecules. For example, antigen, antibody, enzyme, substrate. So the basic use of this chromatography is in purification of hormones, enzymes, and antibodies. Example is purification of insulin using anti-insulin antibody column. Then comes HPLC, that is high performance liquid chromatography. The principle of this is that it is basically an advanced type of column chromatography. It uses high pressure to push liquid mobile phase through tightly packed stationary phase. Separation is based on partition and sometimes adsorption. Components of HPLC system includes solvent reservoir, which give rise to the mobile phase. Then we have a pump, which provides high pressure delivery. We have an injector, which can be manual or automatic for sample introduction. Then there is a column, which is usually of stainless steel packed with silica. And then we have a detector. It can be UV, fluorescence, or electrochemical in nature. And then we have a data system, which basically displays the chromatogram. This picture shows various components of HPLC machine. Types of HPLC. We have normal phase and reverse phase depending upon the polarity of the stationary phase and mobile phase. Clinical applications is in drug assays, hormone estimation, vitamins and HbA1c estimation, and toxicology. Then we have gas chromatography. In gas chromatography, a sample is vaporized and carried by inert gas. It can be helium, nitrogen through a column. Then separation occurs based on volatility and interaction with stationary phase. Liquid coated is that inside the column. Components for gas chromatography includes a gas source, that is a carrier gas, then injector, which heats the sample to vaporize, and then we have a column, which is a long coiled tube inside an oven, and then we have oven which controls the temperature. We have a detector, which is a flame ionization detector, thermal conductivity detector, and we have a data system. This picture shows the various components of the gas chromatogram. Applications in medicine. It is used in detection of volatile organic compounds, alcohol levels in blood, anesthetic agents, fatty acid analysis, environmental toxic monitoring. So this is the comparative table for HPLC versus gas chromatography. Points to remember is that HbA1c estimation is usually done on ion exchange HPLC. Ion exchange or by HPLC. Volatile substances detection is usually done by gas chromatography. Drug assays are usually performed on HPLC. Protein purification is mostly done by affinity chromatography. Retention factor value is mostly calculated in paper and thin layer chromatography. Partition chromatography examples include paper and HPLC. Adsorption chromatography includes TLC and column chromatography. Thank you.